Hello, and welcome to Module 2 of the Resilience and Assertiveness Program for Dupuytren's patients. I'm Eleanor Shakiba, a coach and trainer, and someone who is living with Dupuytren's disease. In this series, we're going to help you thrive despite a diagnosis of Dupuytren's disease by using positive psychology tools. And in this module, we cover a question that pops into the minds of most newly diagnosed patients, as well as those of us who find that our disease is progressing. The first thing to recognise about your treatment options is that they fall into two categories. There's evidence-based options and there's non-evidence-based options. This is important when you're making decisions. It really does help for you to be clear about how much scientific proof you want your treatment to be supported by.
Okay, so if you've got early disease, then there is evidence for radiotherapy or radiation therapy, which has been shown to reduce the chance of progression, in other words, worsening, and also reduce the chance of getting a contracture and needing surgery for that. If you've got advanced disease, in other words, you already have a contracture, then you'll need some sort of treatment which will release that contracture. And broadly, there are three ways of doing that. One is with open surgery, so a fasciectomy, or a dermofasciectomy where there's a skin graft. The next one is called collagenase, which is the injection of an enzyme into the cord to break it up. Unfortunately, that treatment isn't available in all places now. It's been withdrawn from the market. The last thing is needle aponeurotomy, and that is a way of mechanically breaking up the cord with a needle from the outside. All of those options have an evidence base behind them.
Choosing between your treatment options involves gathering information about each one and assessing that information. And the way to do that is to speak to a range of specialists and health advisors. Let's have a look at some of the people that you might need to consult while you're assessing your options.
I have a strong opinion about this. With or without contracture, the first person to see is a hand surgery specialist. Now, this is for two reasons. The first is to rule out other diagnoses that are not Dupuytren. Hand surgeons have more experience than all other specialists with hand diagnoses that might be mistaken for Dupuytren. Things like tendinitis, flexor tendon sheath cysts, flexor tendon bowstringing, diabetic stiff hand syndrome, atypical mycobacterial infections, reflex sympathetic dystrophy, giant cell tumors, sarcomas, and many other conditions. Tendinitis in particular can exist in the same finger at the same time as Dupuytren, and that directly affects treatment. Hand surgeons are more familiar with these diagnoses than other specialists. The second reason is to speed up the time to get to the right diagnosis. The average new Dupuytren patient will see 2 or 3 doctors over the course of sometimes several years before getting the right diagnosis. And again, physicians who don't see and treat the entire range of hand problems may not have the range of experience to distinguish Dupuytren from similar appearing conditions. And this includes rheumatologists, radiation oncologists, internists, alternative medicine specialists.
Early disease, in other words, if you've got nodules, cords, but you don't have a contracture, in other words, you don't have a fixed bending of your fingers, then really radiotherapy is the treatment you could consider. The people that do radiotherapy are called different things in different countries. So in some countries, for instance in the States or Australia, they're called radiation oncologists. In the UK, they're called clinical oncologists. So if you have early disease, really seek an opinion from an oncologist.
once you've worked out who to consult, it helps to plan your approach to your appointment. Many people find that medical appointments are anxiety provoking, and that's natural. The problem with being anxious is that it can trigger a fight or flight reaction, and this is particularly the case if you're presented with information that you weren't expecting. When you're in fight or flight mode, your thinking might distort, and this can lead to behaviours or communication patterns that don't help you get the best results from your appointment. Let's have a look at what happens. So let's start looking at what happens when you're in a fight reaction to stress. Fight reactions lead to feeling defensive and to perceiving your situation as threatening in some way. And so this can cause you to have distorted thinking patterns, which can get in the way of asking for information and following up on things that your doctor has said. When people have flight reactions, what tends to happen is that people close down too early and they fail to speak up, and there will often be a sense of imbalanced power in the conversation. So the moral to the story is, if you want to get the most from your conversations with specialists, it's important to keep a clear head and to move out of fight or flight mode. So how can you do this? Well, it helps to view the appointment as an information gathering session. Remember, you don't have to make a decision right now. Ultimately, it's you that's in charge of what happens next. So address the conversation as one where you're asking questions, you're simply gathering information, and you're going to make some decisions later. So here are some tips on getting the most from your appointments with Dupuytren specialists. Overall, it helps to think of your specialists as trusted advisors who you're going to find information out from. So use your time with them to gather information and ask really good questions. Then you can take that information and use it to make robust decisions about the sorts of treatment plan that are going to work best for you right now. Have you ever experienced decision paralysis? I know that I have. I remember when I had to have surgery to remove a plate from my wrist, and I discovered that this might make my Dupuytren's worse. I'd already booked in for the surgery, but I actually cancelled the appointment a few days ahead once I discovered that I needed to investigate radiation therapy and see whether that was something I needed to factor into my treatment plan. So what I want you to know about making decisions is that it's easy to become fearful and to second guess yourself. All of these questions are totally normal. Although sometimes thinking about the answers to them might trigger a bit of fear, you can also use that fear to your advantage. Remember this: fear is your best friend. It's telling you what you need to know in order to be confident you're making the best decision for you. By deliberately recognizing and addressing your concerns, you're going to feel much more confident that you are making a good decision. Here's an example.
One of the things that I looked at when I was looking at treatment options was I didn't want too much time off sick. I work in the NHS. I've got a really, really busy caseload, and I didn't want time off sick because I knew that there were very few people that could do my job, so they would have to get someone in. And the other thing that I looked at as a diabetic, healing and complications from surgery. I'm very much the least invasive option for me was what I wanted. Recovery time, so how long did it take you to recover from the surgery? How long did it take until you were back at work? So recovery time, infection rates as well. I think working in the NHS, I wanted to make sure in terms of infection rates. I also wanted to look at outcomes. So, for everyone that had those different treatments, what were the best outcomes? What had the least impact on my day-to-day life? And once I'd done that, produced a really good document looking at all of those things that I was very interested in terms of outcomes. And it was that really that made me make the decision to go for radiotherapy.
It's important to remember that Dupuytren's is a long-term ongoing condition. So this means that you're quite likely to need to make a series of decisions over time. Because of this, it's useful to think of creating a treatment plan rather than in terms of making a one-off decision. So, what sort of things should you factor into your plan?
The next thing is to investigate your surgeons and establish a relationship. Connect early with a hand surgery specialist who has a personal interest in Dupuytren. See them on a regular basis, once or twice a year, even if there's no change, so they get to know you and they get to know your version of disease. They'll be a much better resource for it.
Beware of people trying to cash in on other people's problems. There are a lot of products available that don't have a logical or a scientific reason of why they would do anything to treat Dupuytren's disease, and some of them might well be harmful. If products are harmless, feel free to try them, but please be aware there is no miracle cure, cheap or expensive. If it sounds too good to be true, it probably is. Companies that offer different level plans should not need the expensive plans if the cheap one works, and if the cheap one doesn't work, they shouldn't sell it. Forums on Facebook and on the internet and Facebook groups can be set up by anyone. Check that they are affiliated to a genuine Dupuytren Society, run by knowledgeable people, or have specialist doctors attached for advice. Same goes for websites. Most Dupuytren charities work together and are a member of the International Dupuytren Society. So look for websites of one of those charities. Most have a logo of a blue hand with a bendy ring finger in some form.
So there you have it. a few simple tips for sorting out what you can do about managing your Dupuytren's disease. Remember, you're not alone, and that trusted advisors and experienced fellow patients can be a great resource. They're a great resource for managing both the physical and the mental aspects of your condition, so tap into them.